So facial palsy is an injury to the facial nerve, which is one of our nerves coming out of our brainstem in our brain, and the facial nerve feeds along quite a convoluted route actually, and comes out from inside the brain, out through a bony canal, and then outside of the skull, and then it splits into 5 main branches and feeds into the muscles across one side of the face. It also feeds into other parts of the face as well, which can control your tear production, your saliva production, and it feeds into one of the muscles in your ear to dampen down excess loud noises. And when facial palsy occurs, if it's caused by a Bell's palsy or a Ramsay-Hunt syndrome, there's a swelling along the nerve and it gets a bit squashed in that bony canal back here just behind the ear, and that's where the damage occurs. So the nerve swells up inside the bony canal, and the bone then inflicts bruising or perhaps breakage to some of those strands of the facial nerve, which then stop the communication being transmitted to the facial muscles. And then as such, the muscles become palsied. Raising awareness of facial palsy is such a vital element of the work that we do here at Hobbs, because the patient is then empowered to understand how their facial palsy is going to play out, so that if the injury to their facial nerve was significant enough to cause what we call synkinesis, which is where the nerve regrows and feeds into other muscles across the face rather than the original muscle, this person is going to be experiencing tightness and discomfort across their half of their face throughout the day. If they're busy at work, in meetings, in phone calls and presentations all day, then their muscles are going to get particularly tight and very painful. And part of my treatment with them is to identify when in the day they need to have those rest breaks to be able to take themselves off to a meeting room and stretch, release, do whatever they need to do to their tight muscles in their face. So the employer needs to be able to understand that their facial palsy has this impact on them day to day. One of my facial palsy patients had an article published in the Daily Echo in Southampton about trying to raise awareness about facial palsy and how it's affected her, which I think was wonderful and very, very brave for her to do that. Across Hobbs Rehab, facial palsy awareness has grown considerably. I started training as a facial palsy therapist about 8 years ago, and to start with, we didn't have a very big caseload to see, but since I've helped the service to grow, I've become quite busy. I now treat facial palsy patients across all of our centres, across all of our Hobbs centres across the south of England. The team in the various centres that I cover are now very aware that we have a facial palsy service, and referrals are coming in to the right person, and then I will treat those people, book them in for their appointments when I can. It's so important for the NHS website to feature what facial palsy looks like, how it can be treated, how it can be misdiagnosed, because this is the first place that any person will probably go to when they're Googling what's happened to me. And as a national health service, we need to be making sure that we as healthcare professionals are giving the same information to all of our patients, so that it's not misdiagnosed as a stroke, or it's not diagnosed as Bell's palsy when it's actually a palsy caused by a tumour, for example, or a different cause for a facial palsy. So there's so much information on the internet about facial palsy getting better within 3 weeks, and it doesn't happen. All of the patients that I see have had facial difficulties, differences for weeks and weeks and months and months. And some of my patients even come to me with their facial palsy from 30 years ago, and now they want to start doing some rehab to make that better, if there is anything that they can do. And there's such a lot of wrong information on the websites generally, so the NHS need to own this and need to make sure that we're educating not just the patients but the healthcare professionals as well, to recognise such a condition which has such an impact.